Chronic lymphocytic leukemia (CLL) is a type of cancer that originates in the bone marrow and primarily affects a specific type of white blood cell known as B lymphocytes B cells. These cells are part of the immune system and play a role in fighting infections. In CLL, the bone marrow produces abnormal, dysfunctional B cells that grow uncontrollably and accumulate in the blood, bone marrow, and lymphatic tissues, crowding out healthy cells and impairing the immune system. The exact cause of CLL is not well understood, but several factors may contribute to its development. Genetic mutations, changes in the DNA of B cells, which can lead to uncontrolled growth and accumulation. These mutations are usually acquired, not inherited. Family history. The family history of CLL or other blood cancers may increase the risk, suggesting a potential genetic predisposition. Exposure to chemicals. Certain environmental factors, such as exposure to herbicides and pesticides e.g., Agent Orange, have been linked to an increased risk of developing CLL. Age. CLL is most common in older adults, with the majority of cases diagnosed in people over 60. Gender. CLL is more common in men than in women. Symptoms. CLL often develops slowly, and many people may not experience symptoms in the early stages. When symptoms do occur, they may include fatigue, persistent tiredness that does not improve with rest, enlarged lymph nodes, swelling in the neck, armpits, or groin due to the accumulation of abnormal lymphocytes, frequent infections. Due to a weakened immune system, patients are more susceptible to infections. Unexplained weight loss. Significant weight loss without a clear reason. Fever and night sweats. Unexplained fevers or excessive sweating during the night. Enlarged spleen or liver. This can cause discomfort or a feeling of fullness in the abdomen. Easy bruising or bleeding, caused by low platelet counts. Bone pain, sometimes due to bone marrow expansion. Diagnosis. CLL is often detected during routine blood tests before symptoms appear. Diagnosis typically involves complete blood count (CBC), a blood test that shows elevated levels of lymphocytes, a type of white blood cell. Flow cytometry, a test that identifies specific markers on the surface of the blood cells, confirming the presence of CLL cells. Bone marrow biopsy. This involves taking the sample of bone marrow to look for abnormal lymphocytes. Imaging tests, such as CT scans or ultrasound, to check for enlarged lymph nodes, spleen, or liver. Genetic testing, to identify specific genetic mutations or abnormalities associated with CLL, which can help guide treatment decisions. Staging. CLL is staged based on the number of abnormal lymphocytes in the blood, the presence of enlarged lymph nodes, spleen, or liver, and whether there is anemia or low platelet count. The two most common staging systems are RASI system used in the United States divides CLL into 5 stages 0 to ID based on these factors. BNA system used in Europe divides CLL into 3 stages A, B, and C based on the number of affected lymphoid areas and the presence of anemia or thrombocytopenia. Treatment for CLL varies depending on the stage of the disease, the patient's overall health, and the presence of symptoms. In some cases, immediate treatment may not be necessary, and a watch-and-wait approach is used, with regular monitoring. Chemotherapy, often used to kill or slow the growth of cancer cells. Common drugs include fludarabine, cyclophosphamide, and bendamustine. Targeted therapy. These drugs specifically target cancer cells without affecting normal cells. Examples include Bruton's tyrosine kinase BTK inhibitors, such as ibrutinib and acalabrutinib, BCL2 inhibitors, such as venetoclax, monoclonal antibodies, drugs like rituximab, obinutuzumab, and ofatumumab target specific proteins on CLL cells, helping the immune system destroy them. Immunotherapy boosts the body's immune response to cancer, such as CAR T-cell therapy, where the patient's T cells are modified to attack cancer cells. Bone marrow or stem cell transplant, used in some cases to replace diseased bone marrow with healthy cells from a donor. Supportive care. This includes treatments to manage symptoms and prevent complications, such as antibiotics for infections, blood transfusions for anemia, and medications for low platelet counts. Prognosis. The prognosis for CLL varies widely depending on several factors, including the stage at diagnosis, genetic mutations, and response to treatment. CLL is generally a slow-growing cancer, and many patients live for many years with the disease, even without treatment. However, in some cases, CLL can transform into a more aggressive form of lymphoma, known as Richter's transformation, which has a poorer prognosis. Living with chronic lymphocytic leukemia. Regular monitoring. Patients with CLL often require regular blood tests and doctor visits to monitor the progression of the disease and response to treatment. Lifestyle adjustments. Maintaining a healthy diet, staying active, and avoiding infections are important aspects of living with CLL. Emotional support. Coping with a chronic illness can be challenging, and support from family, friends, or counseling services can be beneficial. When to seek medical attention. If you notice symptoms such as unexplained fatigue, weight loss, or swollen lymph nodes. If you have been diagnosed with CLL and experience new or worsening symptoms, including infections or bleeding. If you are undergoing treatment for CLL and have concerns about side effects or the effectiveness of the therapy. Chronic lymphocytic leukemia is a manageable condition with many treatment options available. With advances in therapy, many people with CLL can live long, active lives. Early diagnosis and appropriate treatment are key to managing the disease effectively.